Good day, everyone.
I am Regine B. Berondo.
I am Maria Tricia May Baldumaro.
I am Jovenel Bolante.
I'm Leonor Billones.
And we are
the
group 2.
So first, I will going to give you a learning outcomes. At the end of this lesson, you should be able to first define drug dependence, differentiate drug dependence and drug addiction, discuss how drug abuse can lead to dependence, recognizing the symptoms of drug dependence, discuss treating drug dependence, and last, understand the long-term outlook for people with drug dependence. What is drug dependence? Drug dependence occurs when you need one or more drugs to function. According to the American Psychiatric Association, or the AA, used to distinguish between dependence and abuse. Abuse was considered the mild or early phase of inappropriate drug use that led to dependence. People viewed dependence as a more severe problem than abuse. The APA replaced dependence and abuse with the substance use disorder. And the 2013 edition of the Diagnostic and Statistical Manual of Mental Disorders, or DSM-5, this diagnosis focuses on the disorder involving the use of the substance.
Since you have now the knowledge about drug dependence, now let's talk about the difference between drug dependence and drug addiction. The terms addiction and dependence are sometimes used interchangeably, but they have very different meanings for people who struggle with drugs. Take note that dependence is not the same as addiction. When it comes to substance use disorder, it's helpful to know the difference between drug dependence and addiction. Now let us first understand what is addiction. Addiction is a health condition in which you have strong cravings for a certain substance. These cravings occur due to physical changes in your brain after repeated exposure to a drug, which can lead to uncontrolled drug use, which takes a toll in your health, relationships, career, finances, and other aspects of your life. Being addicted to drugs can cause you to engage in self-destructive behavior or make decisions that hurt other people, such as taking dangerous risks or acting in an aggressive manner towards others. So, what is dependence? While addiction is classified as a disease, dependence is a state of being physically dependent on a certain substance. Addiction is rooted in your brain, but dependence occurs when your body as a whole becomes used to the effects of a drug and goes into withdrawal if you stop using that substance. The symptoms of withdrawal vary by drug, but they can include severe mental and physical reactions. Take note that the more your body adapts to the effects of a drug, the more physically dependent it becomes. So this can, in turn, cause you to end up using larger amounts of that substance to achieve the same desired effects. So now, what is the difference between addiction and dependence? Take note, dependence and addiction can be experienced simultaneously. It is possible to have one without the other. For example, it's possible to become dependent on the drugs without forming an addiction. So here's what we also need to know. Addiction can occur without being dependent on drugs. It may involve using drugs despite the consequences. Second, being unable to stop using the drugs that they are taking. And number 3, they're just neglecting social and their work obligations because of utilizing drugs or illegal drugs. Let's move on to the dependence. It's possible to be dependent on drugs without being addicted. Dependence can be a bodily response to a substance. This often occurs if you rely on medications to control a chronic medical conditions. So these conditions may include first high blood pressure, and then diabetes and glaucoma. Dependence may involve first some or all the symptoms of addiction, development of a high tolerance for the substance as your body adapts to the drug, leading to a desire for larger or more frequent doses, and lastly, physical symptoms of withdrawal when you attempt to stop using the drug. So here's our next reporter, Maria Tresha May Baldemaro, to discuss how drug abuse can lead to dependence.
How drug abuse can lead to dependence. So the National Institute on Drug Abuse estimates 22.7 million Americans need help treating a drug or alcohol problem. In some cases, people may take prescription medication for pain or another medical condition. This kind of use can sometimes develop into a substance use disorder. So we have here the following that are known triggers for substance use disorder. Having a family history addiction. So according to the National Institute on Alcohol Abuse and Alcoholism, family history is one of the biggest risk factor. This meant that anyone with family members who have developed substance abuse issues is at a higher risk of developing substance abuse issues of their own. Next is living in an environment where illegal drugs are often used and easy to access. The consequence of illicit drug use were widespread, causing permanent physical and emotional damage to users and negatively impact their families, co-workers, and many others with whom they have contact. So drug use negatively impact a user's health, often leading to a sickness and disease. Next one is having a history of anxiety. Difficult experience in childhood, adolescence, or adulthood are a common trigger for anxiety problems. Going through stress and trauma when you are very young is likely to have a particular big impact. Experience which can trigger anxiety problems, including things like physical or emotional abuse. Having a history of depression. So the symptoms of depression can drive some people towards substance use to cope with their condition. However, consuming drugs or alcohol to self-medicate this depression symptoms can increase the risk for addiction. Next is having a history of other mental health condition. Mental disorder have had three major explanations, namely the supernatural, biological, and psychological models. For much of recorded history, deviant behavior has been considered supernatural and a reflection of battle between a good and evil. Drug users typically pass through certain stages on the way to drug dependence. One way that healthcare provides describe this stage is with the Jelanic curve. The curve tracks typical stage experienced through occasional use, dependence, disorder, and rehabilitation. These stages include you use drugs for recreation, you take them infrequently in social settings, So, recreational drug use indicates the use of one or more psychoactive drugs to induce an altered state of consciousness either for pleasure or for some other casual purpose or pastime by modifying the perception, feelings, and emotion of the user. You start using drugs on a regular basis, often abandoning family and friends in favor of drug use. You became concerned about losing access to drugs. Partners, parents, children, or close friends can turn into a caretakers, which puts a huge strain on that person. People who struggle with drug addiction or alcoholism can lose touch with their friends and family entirely. Loved ones of an addiction person might blame themselves, causing their self-esteem to erode. The next stage is you became addicted to drugs as you became more tolerant to their effects and preoccupied with getting them. You may abandon most of all your previous interests and relationships. Tolerance is a person diminished response to a drug, which occurs when the drug is used repeatedly and body adapts to continued presence of the drug. And the last is you became dependent on drugs and unable to live without them. Your physical and mental health deteriorates.
Recognizing the symptoms of drug dependence. There are 8 symptoms of drug dependence. You can often determine if an addiction has turned into dependence by looking at behavior. When a person is addicted to drugs hasn't had them for a period of time, these can cause a physical reaction. Physical symptoms of withdrawal occur when the body becomes stressed without the drug. There are 8 symptoms that are including during the drug dependence. First is the anxiety, depression, muscle weakness, nightmares, body aches, sweating, nausea, and vomiting. So how do we treat drug dependence? Can drug addiction be treated? Yes, but it's not simple because addiction is a chronic disease. People can simply stop using drugs for a few days and be cured. Most patients need long-term or repeated care to stop using completely and recover their lives. Addiction treatment must help the person to do the following. First, stop using drugs. Second, stay drug-free. And then lastly, be productive in the family, at work, and in society. So what are the treatments for drug addiction? There are many options that have been successful in treating drug addiction, including behavioral counseling, medication, medical devices, and application used to treat withdrawal symptoms or deliver skills training. Lastly is evaluation and treatment for co-occurring mental health issues such as depression and anxiety. Long-term outlook for people with drug dependence. If felt untreated, dependence on illicit drugs can be dangerous. You may increase your drug use as your body adapts to the drugs. These can result in overdose or death. Treatment can reverse dependence, but you must want to be treated. Sometimes treatment is successful on the first time, but relapse is common. Ongoing therapy and support groups can help you recover, stay on track, and address symptoms of relapse.